Have you ever really stopped to think about how something as simple as pressure can cause so much damage to our body's largest organ? Well, today that's exactly what we're going to do. We're going to build a visual map of the skin's anatomy piece by piece, and then trace the step-by-step breakdown that leads to pressure injuries. Seriously, by the end of this, you'll have a super clear, exam-ready picture of this whole process.
Okay, first things first, let's just take a moment to appreciate what we're even talking about here. The skin isn't just some thin covering, it is a massive, incredibly complex organ. Get this, it makes up about a fifth of your total body weight. That's a huge amount of yourself dedicated to one thing, protecting you. So understanding its structure is absolutely key.
So you ready to become a skin expert? Here's the game plan. First, we'll check out the skin's incredible protective powers. Then we'll take a little journey through its layers, from the surface all the way down. After that, we dive into the nitty-gritty of how pressure just wreaks havoc and what that damage actually looks like. And to wrap it all up, we'll build a quick visual dictionary of common lesions and scars. Let's get into it. So what is the big deal about skin anyway? I mean, is it just a wrapper for our bodies? Oh, not even close. Our skin is basically a superhero in disguise, and right now, we're going to unmask some of its most incredible powers. Just try to imagine a fortress, a high-tech climate control system, and a communications network all rolled into one. That's your skin. It's your shield against invaders like germs, it's a waterproof barrier that keeps you from drying out, and it's a thermostat that keeps your temperature just right. It's even a little vitamin D factory and a sensory hub. But for what we're talking about today, its most critical job is being a barrier. Everything depends on it being healthy and totally intact.
All right, to really understand how skin breaks down under pressure, we've got to look at the original blueprint. We're going to go on a little journey through the three main layers, starting from the very top and working our way down to the foundations. Our journey kicks off at the surface with the epidermis. This is our tough outer defensive wall. It's mostly made of cells called keratinocytes, which produce keratin, the same tough stuff that's in our hair and nails. But what's really wild, and a super important concept, is that this layer is always, constantly renewing itself. It's always rebuilding from the bottom up.
So picture a tiny skin cell going on this epic 30-day adventure. It's born way down deep in the epidermis, in a layer called the stratum basilae. From there, it starts its journey up towards the surface. As it travels, it gets tougher and tougher, until it finally reaches the top layer, ready to be part of that protective shield. And then, it gets shed to make way for the next generation. It's this beautiful, continuous cycle of life and renewal.
Okay, now let's go a little deeper, into the dermis, what some people call the true skin. If the epidermis is the shield, think of the dermis as the busy command center where all the action happens. It's packed with blood vessels, nerves, glands, and hair follicles, all held together by this strong, stretchy network of collagen and elastin. The real MVPs here are the fibroblasts. They're like the architects building everything. And the mast cells, which are the vigilant security guards of our immune system.
And now we've hit the final layer of our journey, the subcutaneous layer. You can think of this as the skin's foundation and power grid. It's a cushy layer of fat and connective tissue that acts like a shock absorber and insulator, and it anchors our skin to the muscle underneath. It's also where you find the major blood vessels and nerves that power everything in the layers above.
Okay, so now that we've got a really solid map of the skin's anatomy, let's talk about what happens when things go wrong. We're going to trace that destructive cascade that leads to a pressure injury, step by painful step, so you can actually visualize how one thing causes the next.
It really does all begin with one simple, powerful force: pressure. When a part of your body gets stuck with sustained, unrelieved pressure, especially over a bony spot like your heel or your tailbone, the tissue literally gets squeezed between that bone and whatever hard surface you're on, and that's where the trouble starts.
Think of your tiny blood vessels, your capillaries, as little highways delivering oxygen and nutrients to your skin cells. When you apply that constant pressure, it's like causing a massive, non-stop traffic jam. Blood flow just stops, the supply line is cut, and those skin cells start to starve.
Let's break this down, because visualizing this cascade is so key, especially for exams. It's a domino effect. First, as you see in step 1, the pressure pinches off the blood flow, cutting off oxygen. That lack of oxygen then damages the delicate inner lining of the blood vessels. That's step 2. In response to that damage, the body forms tiny blood clots that totally block off those vessels. That's step 3. And that leads to the final, awful step, anoxic necrosis. The tissue, starved of everything it needs to live, simply dies.
So, we've just seen this invisible war happening inside the tissue, but what does that microscopic battle actually look like from the outside? How do we see it on a patient? Let's connect the dots from what's happening on a cellular level to what you'll see in a clinical setting.
To really get a handle on how bad a pressure injury is, you have to learn how to read the skin. And that's where staging comes in. It's a standardized system that helps us classify just how deep the damage goes, and it's an absolutely essential tool for any healthcare professional.
Okay, let's decode these stages. Stage 1 is your first warning sign. It's a patch of red skin that's still intact, but when you press on it, it doesn't turn white and then pink again. It stays red. That's what non-blanchable means. In stage 2, the barrier is breached. The skin is broken. You might see a blister or a shallow open sore. With stage 3, the damage has gone all the way through the skin and you can actually see the fatty subcutaneous tissue. And stage 4? That's when the injury is so deep that you can see the underlying muscle, bone, or tendon.
And here it is, a really stark visual of just how devastating pressure can be. This image shows a deep pressure injury, a clear result of that destructive domino effect we just talked about. You can see the total loss of the top layers of skin, with the wound extending way down into the underlying tissue.
All right, now that we're dialed in on pressure injuries, let's broaden our visual vocabulary a little bit and become skin detectives. In this last section, we'll build a quick field guide to some other common skin findings you're likely to come across. Let's start with two really common ones, the plaque and the papule. They're both raised bumps, but here's the easy trick to tell them apart. Think size. A papule, on the right, is small, less than a centimeter. The plaque, over on the left, is its bigger sibling, coming in at over a centimeter. That's it. The main difference is just the size. Next up is the nodule. Now, like the others, it's a raised, firm lesion. But what makes a nodule different is its depth. A nodule is a deep diver. It goes way down into the dermis, which is why it feels much more substantial and solid if you were to touch it.
And let's finish with a classic matchup, the keloid versus the hypertrophic scar. They're both caused by the body going a little overboard with making collagen during the healing process. But here is the one key difference you have to remember. A hypertrophic scar plays by the rules. It stays neatly within the boundaries of the original wound. A keloid, on the other hand, is a total rebel. It breaks out of those boundaries and grows way beyond the original injury.
So we've journeyed through the incredibly complex world of the skin, from its structure to its breakdown. We've seen how it's built, and we've seen exactly how it can be destroyed. The real question now is, what do we do with this knowledge? How can we use this visual blueprint to better protect people, to prevent this kind of devastating damage before it even has a chance to start? The power to do that is really in our hands. Thanks so much for watching.